Setting up an IV administration. Gather equipment required, including the drop set ordered. For this case, we'll be using a 10 milliliter drop set. Always confirm on the back that it is indeed the drop set ordered. Also a reminder that this means it'll take 10 drops in our chamber to form 1 milliliter of fluid. Gather your fluid that is required for administration. For this case, we'll be using normal saline. Open the contents of the packages of each. I'm going to draw your attention to the normal saline here. The first thing we want to do is confirm that it is indeed the normal saline. We want to confirm that it's not expired. We also want to look for any sediment or discoloration or cloudiness to our fluid. These two ports at the bottom, important to note that this one has a rubber stopper on it, similar to that of a vial. This is so we can use a needle and syringe to directly administer medication into the IV bag. This port on the other side has a blue tab on it that we're actually going to pop off to insert our IV line spike into, so then we can get this fluid into our drip chamber and into our IV line. We're going to hang this on an IV pole. For the purpose of this, I have this hung on a wall just so we get a better visual on the whole setup. Your drip set line will come like this. Simply rip off this paper here that holds everything together. Uncoil your line. Ensure that the plastic stopper here isn't kinked off. Ensure that your roller dial is all the way on. Make sure that you have your stopper on as well so you don't leak fluid everywhere. And also make sure that this isn't going to touch the floor or ground. The first thing we're going to do is remove the sterol cap from the top of our spike. The second thing we're going to do is we're going to squeeze our chamber to get the air out. We're going to pull that blue tab and we're going to gently but forcefully push this upward to spike our bag. Blue tab off, disposed of. Grasping the port, making sure we're not touching the outside of this or the inside of our saline bag. Push about halfway up. I'm then going to release my chamber and I'm going to slowly start to see it fill. And I'm just going to leave that for a minute. It should fill about halfway. And what I'm looking for is my saline going down my IV line. What I'm looking for is to make for sure that there's no air bubbles present. If there is, I'm going to turn my roller dial off. I'm going to get my distal end, the part that goes to the patient, and you can take off the stopper tab. Be sure again not to touch this part because that's what's going to go on the patient's IV catheter. Point it down and away from you into a garbage can or bucket and reopen your roller dial. Be sure to flush your line for a few seconds or until you don't see any more air bubbles. Once your air bubbles are gone, close your roller dial. You can now attach this to your patient's IV catheter or put your stopper back on.